Hello and welcome. Today we are going to talk about something very important. These are warning signs that you should never ignore after the age of 60. As we grow older, our bodies change. Some of these changes are normal. Your joints might get a little stiffer. Your eyesight might not be as sharp as before. That is all part of aging. But some signs are not just aging. They are your body's way of telling you that something is wrong. And if you catch these signs early, you can get help faster and stay healthier longer. In this video, I will guide you through the most important warning signs to watch for. I will explain why they matter and what they might mean. I will also help you understand what to say to your doctor so you get the care you need. Let us get started. Warning sign number 1, sudden weight loss or weight gain. If you lose weight quickly without trying, that is not normal. Losing more than 5% of your body weight in a few months can be a sign that something is wrong. For example, if you weigh 160 pounds and you lose 8 pounds or more without changing your diet or exercise, that is a red flag. Sudden weight loss can be caused by many things. It might be a problem with your thyroid, that is a small gland in your neck that controls how your body uses energy. If it works too fast, you might lose weight even if you are eating normally. Another cause could be cancer, especially in the stomach, lungs, or pancreas. Infections can also cause weight loss, especially if they are hidden inside the body. On the other hand, sudden weight gain can also be a concern. If you gain 10 pounds in a short time, but your eating has not changed, your body might be holding on to fluid. This can happen with heart failure or kidney problems. It is not just extra fat. It is a sign your body is not handling fluid the right way. What can you do? Weigh yourself once a week. Write it down. If you see a big change and you do not know why, talk to your doctor. Bring your notes. It helps your doctor see the full picture. Warning sign number 2, shortness of breath. It is normal to feel a little winded after climbing stairs or walking fast. But if you feel short of breath when you are sitting down or doing simple things like getting dressed, that is not normal. Shortness of breath can be a sign of problems with your lungs or heart. For example, it might mean you have chronic obstructive pulmonary disease, also called COPD. That happens often in people who smoked in the past. Or it might mean your heart is not pumping well. This is called heart failure. Your body does not get enough oxygen and you feel breathless. Another cause could be anemia. That means your blood does not carry enough oxygen. This might be because of low iron or a bleeding problem inside your body. Pay attention to when the shortness of breath happens. Is it worse at night? Does it happen when you lie flat? Do you get swollen feet or ankles too? These are clues your doctor will want to know. If you suddenly cannot breathe well or feel chest pain at the same time, call emergency services. Do not wait. It could be something serious like a heart attack or blood clot. Warning sign number 3, chest pain or pressure. Chest pain is never something to ignore, even if it goes away, even if you think it is just gas. After 60, your chances of heart disease go up, so chest pain becomes more serious. Chest pain from the heart often feels like pressure or tightness. Some people say it feels like someone is sitting on their chest. Others say it feels like burning or squeezing. It might spread to your arm, neck, jaw, or back. It might come with sweating, nausea, or trouble breathing. But not all chest pain feels the same. Women often have more subtle symptoms. They might feel very tired, dizzy, or sick to their stomach. That is why any chest pain should be checked. There are other causes of chest pain too. For example, acid reflux or heartburn. That is when stomach acid comes up into the throat. It can feel similar to heart pain, but only a doctor can tell the difference. There is also a risk of a lung problem, like a blood clot or collapsed lung. These can also cause sudden chest pain and shortness of breath. If you feel chest pain that lasts more than a few minutes or comes and goes, call for help right away. Do not wait to see if it gets better. It is better to be safe. Warning sign number 4, sudden confusion or memory loss. Everyone forgets things sometimes. You might forget where you put your keys or mix up names. That can be a normal part of aging, but sudden confusion is different. If you or someone you love starts acting strange or does not seem to know where they are or what is happening, that is not normal. Sudden confusion can be a sign of a serious problem. It might be a stroke. A stroke happens when the blood flow to part of your brain is blocked. This causes brain cells to die. One sign of a stroke is confusion or trouble speaking. Other signs include weakness on one side of the body, drooping of the face, and trouble walking. Confusion can also be caused by infections, especially in older adults. A urinary tract infection or pneumonia might not cause fever or pain at first. Instead, the first sign might be acting confused, sleepy, or upset. Another cause is medicine. Some medications can make you feel confused or dizzy. If you start a new medicine and feel different, tell your doctor right away. You can help by writing down what you notice. When did the confusion start? Is it getting worse? Are there other signs? This information helps your doctor find the cause faster. Warning sign number 5, new or severe headaches. If you have had the same type of headache for many years and it has not changed, that is usually not a concern. But if you get a new kind of headache after 60, you should see a doctor. Headaches that come on suddenly and feel very strong might mean something serious. One example is a brain bleed. This can happen if a small blood vessel in your brain bursts. The pain is usually sudden and very intense. Some people call it the worst headache of their life. Another cause is a condition called temporal arteritis. This is when the blood vessels in your head become inflamed. It usually causes pain on one side of the head or near the temples. It may hurt to chew. Your vision might also be affected. If this condition is not treated, it can cause blindness. Doctors can diagnose it with a simple blood test and a small biopsy. Headaches can also be caused by high blood pressure. If your blood pressure is very high, it can cause head pain and put stress on your heart and brain. Keep track of your headaches. Write down when they happen, how long they last, and what they feel like. If they are getting worse or feel different from before, it is time to see your doctor. Warning sign number 6, changes in vision or hearing. Your eyes and ears may slowly change with age. You might need reading glasses. You might ask people to repeat themselves more often. But some changes happen suddenly, and those are signs you should not ignore. For vision, pay attention to these signs. Sudden blurry vision, seeing double, flashes of light, a dark shadow in part of your vision. These can mean something serious like a retinal detachment or a stroke in the eye. Retinal detachment means the layer at the back of your eye is coming loose. It can lead to blindness if not treated quickly. Seeing flashing lights or many new floaters might also be a warning. Floaters look like little spots or cobwebs in your vision. A few are normal. But if you suddenly see a lot or they come with flashes of light, see an eye doctor right away. For hearing, be alert to any sudden loss. If one ear stops working well, all of a sudden, you should see a doctor fast. Sudden hearing loss might be caused by a virus or a blood flow problem. In some cases, fast treatment can help restore hearing. Ringing in the ears, also called tinnitus, can be a warning sign. It might mean your ear has been damaged. It might also be linked to high blood pressure or other health problems. Try to notice how your senses change. If something feels different or changes, suddenly do not wait. Your doctor or an eye and ear specialist can help find the cause. Warning sign number 7, problems with balance or coordination. Losing your balance once in a while may not seem like a big deal, but after 60, balance problems can become dangerous. Falls are one of the most common reasons older adults end up in the hospital, and often they are preventable. If you find yourself feeling unsteady, or if you have started using furniture or walls to keep your balance, that is a warning sign. Feeling dizzy when you stand up could be a sign of low blood pressure or dehydration. It might also be a side effect of medication. More serious causes of balance problems include stroke or inner ear problems. Your inner ear controls how your body stays upright. If something is wrong with the inner ear, you might feel like the room is spinning, or you might feel pulled to one side. Poor coordination can also mean problems in the brain or nervous system. If your movements seem shaky or jerky, or if you suddenly have trouble walking in a straight line, you should be checked by a doctor. To stay safe, remove loose rugs and clutter in your home. Wear shoes with good grip. Tell your doctor if you have fallen or nearly fallen. That information is important and can lead to better treatment and safety. Warning sign number 8, changes in bowel or bladder habits. It is common for bowel and bladder habits to change slowly with age. You might need to use the bathroom more often or feel more urgency, but sudden changes or unusual patterns can mean something more serious. Let us talk about the bowels first. If you suddenly have constipation that lasts more than a few days or diarrhea that does not stop, it is time to check with your doctor. Blood in your stool is a big red flag. It might look bright red or very dark like tar. This can be a sign of bleeding inside your digestive tract. Changes in the shape or size of your stool, especially if it becomes thin, like a pencil, could mean something is blocking the colon. One possible cause is colon cancer. That is why regular screening like a colonoscopy is so important after age 50. Now let us talk about the bladder. If you find yourself needing to go all the time, or if you have pain when you urinate, it might be an infection. Urinary tract infections are common in older adults, and they may not always cause pain. Sometimes they just cause confusion or tiredness. For men, trouble starting urination or weak flow might be caused by an enlarged prostate. This is very common and usually not dangerous, but in some cases it might point to prostate cancer, especially if it comes with pain or blood in the urine. For women, leaking urine or feeling pressure in the pelvis might be a sign of pelvic organ changes. These can often be treated with simple exercises or other care. If you notice any blood in your stool or urine, you must talk to a doctor. It is not normal even if it happens just once. Warning sign number 9, persistent fatigue. We all feel tired sometimes, but if you are feeling tired all the time, even after resting, that is a sign something might be wrong. Fatigue is not just about sleep. It means your body feels drained, like you cannot do the things you used to. If it takes too much effort to get out of bed or take a walk around the block, that is more than just aging. One possible cause is anemia. That means your blood does not have enough red cells to carry oxygen. You might also look pale or feel dizzy. A common reason for anemia is low iron, which can happen slowly over time. You can find iron in foods like beef liver chicken, dark leafy greens and beans. For example, 1 cup of cooked spinach has about 6 milligrams of iron. Adult women after menopause and men usually need about 8 milligrams per day. Fatigue can also come from heart problems. If your heart is not pumping strongly enough, your muscles do not get enough blood. You might feel tired after small tasks like cooking or walking across the room. Fatigue can be the first sign of heart failure or blocked arteries. Another cause of fatigue is depression. Depression in older adults is often missed because people think sadness is a normal part of aging. It is not. If you have lost interest in things you used to enjoy, or if your sleep and appetite have changed, tell your doctor. Keep a small diary. Write down when you feel most tired and what you were doing. This can help your doctor find patterns and suggest the right tests or treatments. Warning sign number 10, skin changes. As you get older, your skin will naturally become thinner and may develop more spots, wrinkles, or dryness. That is all part of aging. But certain changes in your skin can be signs of something more serious and should not be ignored. Watch for any new moles or spots, especially if they change in size, shape, or color. A normal mole is usually small, round, and one even color like brown. If a mole starts to look different from your other moles, that can be a warning sign. There is a simple way to remember what to look for. It is called the ABCDE rule. A stands for asymmetry. That means one side of the mole does not match the other. B is for border. If the edges are jagged or uneven, that can be a concern. C is for color. More than one color or shades of black, red, or white are not normal. D is for diameter. Moles larger than the size of a pencil eraser should be checked. E is for evolving. That means any change over time. Another thing to watch for is a sore that does not heal. If you have a spot on your skin that keeps bleeding, scabbing, or never seems to get better, it could be a sign of skin cancer. Skin cancer is the most common type of cancer, but when caught early, it is very treatable. One common form is called basal cell carcinoma. It often looks like a small pink bump that does not go away. Another type is squamous cell carcinoma, which might look like a rough scaly patch. The most serious type is melanoma. That is the one to watch for with changing moles. Protecting your skin is still important even after 60. Use sunscreen when you go outside. A good rule is to choose a sunscreen with at least SPF 30. To give you a comparison, SPF 30 blocks about 97% of harmful rays. That is like wearing a protective hat for your skin. You should also wear a wide hat and long sleeves when out in the sun for a long time. Check your skin once a month. Use a mirror or ask someone to help you check your back. If you see something new or something that has changed, talk to your doctor or a skin specialist. Conclusion: trusting your body and taking action. Thank you for spending this time learning about your health. The older we get, the more important it is to listen to our bodies. Not every small change is a problem, but some changes are warning signs. They are your body's way of asking for help. We have talked about 10 signs today: sudden weight changes, shortness of breath, chest pain, confusion, new headaches, vision and hearing problems, balance issues, bowel or bladder changes, fatigue and changes in your skin. These are signs you should never ignore. If you notice something unusual, do not wait. Make a note of what is happening. Tell someone you trust and talk to your doctor. Early action can save time, money, and even your life. You have the power to take charge of your health. Staying informed is the first step. Sharing what you learn with friends or family is the next. When we take care of ourselves, we also help those around us stay safe and strong. And remember, you are never too old to pay attention to your health. You deserve care, respect, and good support. Take the time to rest, eat well, move your body, and speak up when something feels wrong. Thank you for watching. Stay safe, stay strong, and take good care of yourself.